At the next intersection, turn left. Turn left.
If you talk about 50 years ago, brain surgery is typically done through large incisions, big skull opening. And a lot of brain tissue is pushed aside or retracted to get to the tumor. And as a result of that, you get a lot of scarring, a lot of temporary damage. Patients do take a longer time to recover. We're talking about months of recovery. Invariably, many patients have weakness or speech dysfunction after such brain surgeries. But right now, we have technologies that can direct us to the tumor in a more precise manner. Things like navigation. Navigation is essentially GPS for the human brain. We use navigation systems during surgery to help us find the safest, shortest path to the tumor, and we are able to use that to remove the tumor in a faster and effective manner without causing any compromise to the surrounding brain tissue. And by using GPS, everything becomes smaller because we have a better pathway, we have a more precise pathway. So the brain, the skull opening is smaller, is more targeted, more precise. We don't really have to shift things away or push things away. We can go in between brain structures or in between spaces that exist in our skull to get to the tumor and remove the tumor without causing much or no damage to the surrounding brain structures. And most of my patients, when I operate using all this current technology, they're immediately woken up after surgery. They're not in a comatose state. They don't go back to ICU with tubes here and there. They are woken up and their recovery is shorter. They recover within hospital stay of about 3 to 5 days, and then by the time they go home, their recovery takes about 2 weeks to 3 weeks, and they're back to their normal social life. So navigation is one of the new technologies that I use regularly in my work because it really reduces operating time, reduces risk of damage, makes surgery faster, more effective, more precise, and overall allows me to perform surgery to a smaller skin incision.